Genesis Communications presents the show that's helping people see better and feel better all over Florida. It's Ask the Doctor with board-certified optometric physician, certified nutritional specialist, and popular radio host, Dr. Michael Lange of Lange Eye Care and Associates.
Doctor, my eyes, but can I see the sky? Is this the prize for having learned how not to cry?
Alrighty, good morning, and welcome to Ask the Doctor. I'm your host, as usual, Dr. Michael Lange. I'm a board-certified optometric physician. I'm also a certified nutritional specialist. I'm the founder of the Lange Eye Institute, Lange Eye Care and Associates, as well as Fortify Vitamins. Remember, this is a live call-in show, so if you have a question regarding any aspect of your vision or eye care, pick up the phones and give me a call. I've been hosting Ask the Doctor now since, April of 1993 on multiple radio networks throughout the great state of Florida, live video streaming all over the world and over the internet, iHeartRadio, Intune Radio, places like that. We've picked up a couple of new radio stations. We're actually now in Montgomery, Alabama. All right. About a month ago we went on. That's 1440. That's Montgomery, Alabama, 1440 News Radio, 1440. And also Atlanta is going to be picking us up in a couple of weeks. That'll be 640 WGST in Atlanta. But we're broadcasting from Genesis Communications this morning here in beautiful Largo, Florida. And we're on 820 AM. Also 97.3 FM up in Gainesville and in Ocala. So once again, if you have a question, give me a call, 1-866-977-4820. I'm a board-certified optometric physician. I'm also a certified nutritional specialist. This is a live call-in show, so any questions at all regarding your vision, eye care, or a nutritionally related topic, I'll try to answer it to the best of my ability. I've been in clinical practice since, 1992. I see a lot of patients at the Lange Eye Institute now. This is where I hail from. The Lange Eye Institute is about a 30,000 square foot state-of-the-art eye care center right in the heart of Florida in the Villages. That's the geriatric golf cart capital of the world. Everybody retires there. It's Disney World for retirees. So once again, if you'd like to see me personally, or if you're interested in seeing any of our other doctors, if you're interested in cataract surgery, retinal surgery, nutritional eye care, contact lenses, pediatric all the way to geriatric, we'll take care of you at the Lange Eye Institute. Also, remember, I started Fortify Vitamins over 10 years ago. This is a company based on solid research. It's evidence-based nutraceuticals that I've done research and I've developed personally. You can learn more at fortify.com. Fortify is FORTIFEYE. You can learn a lot about our research on the website. And if you'd like to call Fortify Vitamins Monday through Friday, we're closed on the weekends. I'm not a slave driver, so you can call Fortify Vitamins. Write this number down, because anything I talk about on this program, you can actually call this toll-free number, and they usually are aware of what I talk about in this program. If you want to order your vitamins that we talk about on this program, you can call 866-503-9746. That's 866-503-9746, or go to fortify.com, FORTIFEYE, fortify.com. All right, what are we going to talk about today? Well, we're getting close to the end of the year, so everybody should have a New Year's resolution. We're going to talk about that in a few minutes, but let's open the phone lines, 1-866-977-4820, 866-977-4820. Go ahead and give me a call, no matter how simple or complicated the question is. I will educate you, and this is for educational purposes only. This never replaces a comprehensive eye exam or a medical evaluation. It's for educational purposes only. All right, let's go to the phones. I think it's Bob. Bob in Ocala. Good morning. Welcome to the program.
Good morning, Dr. Lange, and I want to confirm that listening to you is an education.
Thank you, Bob. You've been listening a long time.
You have been remarkable, sir.
You could co-host the show with me. You could probably host the show when I'm on vacation.
I wouldn't want to do that, but I'd love to sit next to you someday.
Anytime. Come on in.
That would be an experience, I'm sure. maybe put that in my bucket list. How'd that be?
There you go. You're invited anytime you want to come down.
Thank you. Dr. Lange, today this week I've been doing a little more listening and studying on cleansing, whole body cleansing. there's a lot of advertisements on infomercials on the radio about juice cleansing and this and this and that. Is there a good, better, best when it comes to cleansing?
All right, it's a great question. I mean, you can't believe everything you hear. Remember that, first of all. Everybody's trying to make a buck.
Talking to you,
right. And if you lead the right lifestyle, okay, if you do what I preach on this program, you don't need to go through these cleanses, all right? I mean, eat an organic, gluten-free, paleo type of diet, okay? They're not going to get all the toxins. People that are eating the traditional pro-inflammatory, high in omega-6 typical American diet, yeah, cleansing is probably good for them. But if you're eating something like organic gluten-free paleo, and if you have irritable bowel syndrome, following FODMAP-free, FODMAP, FODMAP-free foods as well, and you're doing things like getting plenty of sleep, hydrating, and you're drinking the right water, not the water out of your tap. God forbid you're drinking water that is in copper pipes, all right? So drinking spring water. Go to the store, spend a little money, buy spring water. Make sure it says spring water on it, because this is alkaline water with minerals, not reverse osmosis, not chlorinated, fluorinated water from your tap, and not distilled water, because these things are leached of minerals and very acidic. So if we eat right and we drink the right fluids, all right, we're getting plenty of sunshine. Vitamin D is very important. Remember, we're all vitamin D deficient. Exercise, all right? When you're out exercising in the sun, it's a triple whammy. You're getting cardiovascular, you're getting muscle tone, you're getting vitamin D, and you're detoxifying when you're exercising because you're sweating. So sweat is a very good way. So you could actually go into a sauna and sit in a sauna for 20 minutes and sweat. This gets a lot of the heavy metals out of your system. But exercising, once again, so if you practice all these things, then you got to get plenty of sleep, okay? Sleep is not overrated. You got to get 6, 7, even 8 hours of sleep at night, and you got to do what it takes to get that sleep. And I'm not talking about tying one on and passing out, because then you're going to be toxic again. So there's some things you can do to help sleep. Turn the computer off right before, about 2-3 hours before you go to bed. No TV 2 to 3 hours before you go to bed. Drink some black or tart cherry juice about an hour or 2 hours before bed. No exercise 2 hours before bed. There's a lens I developed that I talk about. This called blue light defense. Wear the blue light defense lenses to block this blue light that causes melatonin levels to drop, and then you become sleep impaired. So this is kind of what I was going to talk about for New Year's resolutions. This is, having a non-toxic body to begin with, all right? Now, if you want to do some things to help detoxify, you can drink lemon water and lime water throughout the day. You can go into the sauna. You can juice. There's nothing wrong with juicing, but you got to be careful. You can't juice too often, because then juicing has a lot of sugar, all right? You got to juice the right fruits and vegetables. Never juice carrots, okay? Don't juice carrots with spinach and kale, I should say, because the beta-carotene blocks the absorption of the lutein, the zeaxanthin, the astaxanthin, the carotenoids that are good for you. So if you want to juice carrots by themselves, that's fine, but never with dark green leafy vegetables. So a good juice to help detoxify would be spinach, kale, okay, cucumbers, an apple. Throw some cayenne pepper in there. Put some ginger in there and juice that. And you could drink that 3 times a week, all right? But I'm not big in going on these big juice cleansing fads where you don't eat anything and you only juice for 5 days. I mean, these things can be very unhealthy, all right? You got to eat food during the day. 5 small meals a day. But remember, Bob, the right food, okay?
Well, Dr. Lange, I guess I should have prefaced it. For those of us, unfortunately, who have got 70 years plus under our belt and haven't eaten the best over the past 70 years, just converting to a gluten-free paleo diet, would that be enough to take care of us, or do we need to take an extra precaution?
Yeah, but do the other things we just talked about, all right?
Yeah.
Water is cleansing. Sweating, exercising, that is cleansing. If you want to try some of these cleansing fads, you can try them, but a lot of those things are going to be very expensive. Here's another thing you can do that helps detoxify the body is a good whey protein concentrate. Remember, it's got to be from grass-fed, organically raised, or grass-fed cows, preferably New Zealand cows. And, of course, we developed one called Fortify Super Protein. So you could do that as a meal replacement. You could take our organic blue-green superfood, combine it in water or almond milk, shake it up with the protein, boom. That's a meal replacement, helps you lose weight, but it also helps you detoxify. Or just take some vegetables and some fruit, blend it all together in water or unflavored almond milk or A2 cow's milk or goat's milk, and you got a really good detoxifying, high-protein, anti-aging, glutathione-stimulating protein drink. Now, here's another tidbit of advice. When you're putting fruits in your smoothies, only use one fruit. Use vegetables, only one fruit, not more than one fruit. If you're really on a fruit binge, put 2, but never 3, 4, 5. I see people, putting mango and banana and pineapple, blueberries and strawberries and raspberries. That's way too much sugar, and these fruits don't always interact well together. Sometimes it can create sensitivities. So one fruit and vegetables, and you're good to go. All right?
Excellent. I will refer to my original statement. You are a wealth of information, young man, and I truly appreciate you. Merry Christmas to you and Tammy and your family. And you're going to be on the air next week?
I will be live. Yes, sir.
Okay. Well, then, Lord willing, we'll talk to you next week. Have a good weekend.
All right, Bob. Take care. Bye-bye. Bob's been a caller. He always has some interesting calls. He's been a caller for 10 years at least. All right. Phone lines are open. If you got a question, give me a call. 1-866-977-4820. 1-866-977-4820. Any question at all regarding your vision, eye care. I know a lot of you are out and about shopping for Christmas, last-minute shopping. I'm going to have to do that myself. I actually have the day off, so I'm going to get to the stores. Hopefully they're not too packed. One more time, if you have a question anywhere in the continental U.S., you can call me at 1-866-977-4820. You also can watch us on News Talk Florida /video, or you can just go to newstalkflorida.com and go to live video, and you can actually see me, what I'm wearing today. I might have a big straw hat on. You never know. All right, one more time, 1-866-977-4820. So New Year's resolutions are very important, all right? One thing I didn't talk about with Bob is the most important thing is ideal body weight. You got to get down to your fighting weight. If you're overweight, you got to lose weight. I preach to my patients all the time. If they come in with macular degeneration, diabetic retinopathy, glaucoma, dry eyes, and they're overweight, first thing we got to do is lose weight. If you can pinch an inch, that's okay. But if you can pinch 2 inches, that's way too much, all right? So if you're overweight, you got to get on a good regiment to lose weight, all right? Less calories, more exercise. It's simple math to lose weight. It's simple math. Mathematicians aren't fat, are they? So I created a system. I guess we can call it the Lange diet system, a Lange weight loss system. You can learn about it if you go to fortify.com, and go to news. And then on news, there's a lot of good information on there. But you can go to news, and it's about weight loss. Fast, safe, healthy weight loss. The average person that is on this plan that I've developed, which is super simple, loses 4 pounds a week if they follow it. 4 pounds a week without changing anything. Then if you do a reasonable breakfast and lunch and you do some exercise, you can lose 5 to 6 pounds a week. Cody, one of my technicians, lost 14 pounds the first week on this, and he's healthier now because of it. So go to fortify.com, go to news, and you can read about this weight loss program. It's basically taking my Fortify blue-green, organic blue-green superfood and Fortify super protein, mixing the two with water, spring water, and taking that for supper, all right? And then adding some omega-3 fish oil, and then to top it off, if you really want to lose weight faster, some of the Fortify probiotics, and you will be a fat-burning machine. I guarantee it. That's my coon-ass New Orleans accent coming out there. All right, let's go back to the phones. Sharon in the Villages, good morning.
Good morning. My question is, I have gastroesophageal reflux disease, and I was told that apple cider vinegar actually does the opposite of the white vinegar, and it actually reduces stomach acid, and I was wondering if that's true or not.
Well, apple cider vinegar doesn't really reduce acid, okay? But a lot of these acid reflux problems are sometimes, believe it or not, related to not enough acid, okay? But it also causes there's a sphincter valve that causes backlash of acid to come to constrict, okay? So if somebody's having heartburn, acid reflux, it's interesting. I had a friend of mine, a Cajun down in Houma, Louisiana, call me one time. He says, Mike, I'm having a heart attack. And I said, well, go to the emergency room. He goes, I don't want to go to the emergency room. And I said, you sure you're having a heart attack? And he says, yeah, I got the worst pain in my chest. And I said, what did you have? And he said, well, I had some jambalaya, some boudin, and I had some gumbo, and I had a lot of, Tabasco sauce on it. And I said, well, it's probably acid reflux. I said, does your wife have any apple cider vinegar? And she did. She has Mother's apple cider vinegar. It's got that cloudy stuff in it. It's the Mother. So it's Bragg's apple cider vinegar. I said, go get a shot of that and just take a shot of it when you're on the phone with me, all right? And then chase it with some water. And he goes, no, I'm not going to do that. And he finally said, do it. He did it. Within 35 seconds after he did that, all of his pain went away. It was all acid reflux. I mean, it helps that quickly, and it's natural. So that's something that can help if you're having really a bad flare-up, okay? But the key is not to have this. So once again, drinking water that has minerals in it, like spring water, taking enzymes with the food that you eat, the cooked food. Try to eat a raw vegetable or a raw piece of fruit with every meal, or take the enzymes with it. Then take a good probiotic first thing when you wake up in the morning, last thing when you go to bed, a good probiotic, and eat some fermented food during the day. Some sauerkraut, some miso soup, some tempeh. That has to be organic if it's soy, all right, because most soy is genetically modified. Kombucha, all right, kefir. But if the kefir you're going to drink, you got to have goat kefir, goat milk kefir. Don't drink the other milk because it has a genetically mutated casein protein in it, and you can buy goat kefir at certain health food stores and certain types of places, maybe like Fresh Market and Whole Foods. If you do these things, ideally, we don't want you to have this acid reflux that creates problems. And then a lot of times your doctor's going to put you on these antacids. The problem with antacids is sometimes you get the rebound effect. You're actually lowering the acid, and your body secretes more acid. You got to take more and more. Also, these type of acid blockers can actually block the absorption of nutrition, causing you to be nutrient compromised. So I love to do it on a natural approach.
Okay. Now, I've had this, you don't know this, but I've had this since 2009, and I was diagnosed, my doctor diagnosed it, and I can't have any milk. If I do, it's really bad. I really have it full-blown. No dairy products at all. If I try to take them, it's really bad. I can't have citrus, vinegar is out, lemon, there's just so many things I can't have. Tomatoes,
Right.
All these things I can't have. So when you mention that it's okay for me to have some things that have acid in them, I just can't have them.
Right.
So I mean, this has been going on a long, long time.
So Sharon, when you should try goat milk. It has nothing to do. It's not like regular dairy. People, it's like 70% of the population has problems with regular dairy, and that's not necessarily because they're lactose intolerant. It's because of the casein protein. The beta-casein protein is releasing histamines, which causes you to have reactions because of this genetic mutation that happened thousands of years ago. Goat milk has not gone through that genetic mutation. It's all A2 beta-casein protein, and most people can have that goat milk. So you could always try that, or goat kefir. And then something else you might want to try, take some Bragg's apple cider vinegar and take some Manuka honey. It's got to be Manuka, okay?
I can't have honey.
All right,
I've got another problem. I have a colitis. It's lymphocytic microscopic colitis. Only people over age 50 get it. So I can't have sugar or honey or any of those kind of things.
Right. But once again, Google Manuka honey when you get off of this, okay? Manuka honey isn't your typical honey. Diabetics can have Manuka honey. Google it and see what it has. But it has some interesting anti-aging attributes. But you could try the Mother's apple cider vinegar. Put a teaspoon in spring water, in a cup of spring water, and try drinking that, a couple of times and see how you do.
So it's different. The apple cider vinegar is different than the white vinegar.
Oh, absolutely.
White vinegar I have a problem with, but I wouldn't have a problem with the apple cider vinegar.
Right. You want to
I want to put it on my salad. I can't have any salad dressings. I can't have onion. Can't have milk. There's just so many things in salad dressing I just can't have. No garlic.
Absolutely.
So,
try the apple cider vinegar, but it's got to have the mother in it, all right? Not the father, the mother. So when you look at it, it's very cloudy, and simply just buy Bragg's. It's organic, Braggs. I love Bragg's apple cider vinegar. Try it. Give me a call. Let me know how you're doing, all right? Don't overdo it. Like maybe a half a teaspoon in a cup of water, spring water. Not distilled water, not your faucet water, okay?
I've got Heinz vinegar. I better return that. That's probably going to give me trouble,
Yeah,
right?
Don't use that. Got to get Bragg's. Bragg's with the mother, okay?
Okay, all right. Thank you, doctor.
Sharon, take care. Bye-bye.
Thank you. Bye-bye.
All right, you're listening to Ask the Doctor. I'm Dr. Michael Lange, your host. If you got a question regarding your vision or eye care or a nutritionally related topic, give me a call, 1-866-977-4820, 1-866-977-4820. Going back to talking about New Year's resolutions, all right, ideal body weight. Remember, you got to get down to your ideal body weight. If you're overweight, the beneficial nutrients for your eye actually go to the fat. So you got to lose that weight. 5 small meals a day, all right? Don't eat till you're full. Stop eating with a small portion, all right? Breakfast, an egg omelet with spinach and mushrooms, sautéed in coconut oil, some water. Lunch, a boiled chicken thigh with some boiled broccoli. Supper, wild Alaskan salmon. Never touch farm-raised salmon. Wild Alaskan salmon with a salad with lots of greens and maybe some blueberries in it, and a glass of water or organic green tea. If you drink green tea, I like Longines Dragonwell green tea. It's top notch. We usually have some of that at our nutrition center in Ocala. You can always go to the Fortify Vitamin Center. It's also our nutrition center in Ocala. It's right there on 17th Street, right next to Wood U. Or you can go to fortify.com and see where the directions are. If you go into the Fortify location in Ocala, actually, you can try our protein, you can try our organic greens, you can try our fish oil. Our fish oil is so good you can bite into it, it squirts in your mouth, and it doesn't taste bad. I guarantee you will not have a burp back. But you can try it before you buy it. You can go in there and have your lunch. Ask them to mix the greens with the protein, shake it up in some unflavored almond milk, and have that for your lunch. It's lunch on me. And if you like it, you can buy it. If you don't, you get a free lunch. Remember, you can always order these at fortify.com. You can call toll-free at 866-503-9746. All right, I do want to mention Dr. St. Martin. Jamie St. Martin is on the team at the Lange Eye Institute now. She's a board-certified optometric physician. She's residency trained in ocular disease, and she's also a fellow of the American Academy of Optometry. Dr. Jamie St. Martin used to have the clinic inside the Lens Crafters in Ocala. She's now at the Lange Eye Institute in the Villages, and all of her records have been transferred. Also, I do want to mention a couple of places in the Clearwater area and in Sarasota that are carrying Fortify vitamins. In Clearwater, it's Gulf Coast Nutrition. That's Dr. V and Brenda B. Right there on 2906 Alternate Highway 19 in Palm Harbor. That's Gulf Coast Nutrition. So you can get the entire line of Fortify vitamins at also an incredible supplement place. It's called Professional Supplement Center. And that's right there on Palmer Crossing, 5441 Palmer Crossing Circle. And they're open today, Saturday. They both are 9 to 1 today. So Professional Supplement Center in Sarasota, Gulf Coast Nutrition in Palm Harbor. Remember, Fortify Vitamins is open Monday through Friday. All right, you can follow me on social media. You can follow me on Twitter. You can Google+, LinkedIn, Facebook, Pinterest, Snapchat, Instagram, all those ways you can follow me. Twitter, Michael Lange OD. Not a bad place to follow me because I'll give you a lot of discount codes just randomly during the day, and you can save a lot of money on the Fortify vitamins. Also, let's talk about cardiovascular exercise. It's very important. all of us should get out and do 20 minutes of cardiovascular exercise, 30 minutes of cardiovascular exercise, 3, 4, 5 times a week. Biking, recumbent biking if you're a male. You want to preserve prostate health? Yes. Recumbent biking. I mean, I love road biking, mountain biking, but get a recumbent bike. It takes all the pressure off your prostate and the boys down there. So it's very good. It hits your glutes, it hits your thighs, your quads, your calves better than anything. Recumbent biking is great. Swimming is great. Rowing is incredible. How about sculling? Now, this is a new one. I just bought a skull, and I got to mention the people I bought it from over here in Gainesville, Florida. Little River Marine, I think is the name of it. I wrote it down someplace, and of course, I don't have it in front of me. But after the break, I'll let you know if it's called. I think it's Little River Marine, right there in Gainesville. But they have these skulls, and I got a one-man skull. You see those people skull racing, at universities. They do it on the rivers. Harvard's big at doing it, but they do it here also in Tampa. I got to tell you, it's not as simple as it is. I mean, it's pretty tough. That little thing is very, very tippy. So sculling is not as easy as it used to be. After the show, I'm going back in Tampa Bay. I'm going to try to not tip over, try to master this. All right, once again, phone lines are open. 1-866-977-4820, 1-866-977-4820. We're going to talk about how eye is the window to the soul after the break, and how we can detect things like Alzheimer's, also diabetes, thyroid problems, high blood pressure, brain tumors, arthritis, through a routine eye exam from your optometrist or your ophthalmologist. But we're going to go to the phones, and then we're going to take a break right after this phone call. Joe in Tampa Bay, good morning. Thanks for holding.
Hey, Dr. Lange, how you doing?
Hanging in there.
Merry Christmas.
Thank you. Merry Christmas right back at you.
Okay, I heard you mention something called Lange tea a couple minutes ago.
Right.
Is that how it's pronounced?
Lange Dragon Well, okay? This is one of the best green teas on the market. It's what the premier of China drinks, the emperor of China. It is incredible. It's got a good taste to it, and it's not super high in caffeine, so it won't give you the jitters. It's higher in theanine, which actually helps you relax, believe it or not. And it's organic. So organic Lange Dragon Well. You can drink 5 cups a day.
Okay, I've been using matcha green tea.
Matcha green tea.
Yeah, matcha.
Yeah, matcha's fantastic. Let me tell you, matcha it's like taking concentrated green tea leaves and concentrating them even more. Only problem with matcha is some people that have a little bit of a sensitivity to caffeine will have some issues with that. So I love matcha tea. It's probably the most potent antioxidant in a tea known to man. But I wouldn't drink 5-6 cups of matcha tea a day. I mean,
right.
you would be wired, okay?
Yeah.
But Dragon Well, Lange Dragon Well, you can drink that like water.
Okay, so if I'm already doing matcha green tea, that's top of the line.
Oh yeah, matcha green tea is fantastic. Make sure it's organic because
Right.
it's concentrated, so it's got to be organic. Absolutely, it's good stuff.
Okay, and I have a question sort of off the beaten path here.
Mm-hmm.
I read somewhere where when you take your temperature in the morning, if it's below 97.6, you might have a thyroid problem. Is that true?
Yep. That's a possibility. You can have adrenal fatigue as well. If your temperature is low, then you need to talk with your doctor and find out why. Okay. There's a whole host of things that can cause that. Or unless you're sleeping on an ice bed and you're cranking the air condition down to 58 degrees like I do. But if it's too low, that's not a good thing. By the same token, if it's too high, that's not a good thing. But elevated temperature can be good because that can fight off the infection that you have. So sometimes you don't want to jump on aspirin and things like that immediately when your fever goes up. You want to try to let it go its course and see what happens. But obviously, it stays elevated for a long period of time. You got to do it. If your fever goes really high, obviously you got to treat it or go to the emergency room.
So I mean, if you have hypothyroidism, wouldn't being had no energy be a symptom of that, wouldn't it?
Oh, yeah, hypothyroid, and a lot of people have Hashimoto's disease. Hypothyroid can cause a whole host of things. It can cause you to be very sluggish, very tired, lethargic, weight gain. I mean, you can get really fat fast with a hypothyroid. But, they can run some blood tests, and they can find out if you have a thyroid problem. I got to tell you, Dr. John Podlatsky upstairs at the Lange Institute treats thyroid problems naturally. He'll never put you on a drug, and he gets some really, really good results with that.
And he can test for it, too?
Oh, absolutely. He can test for it right there in the office.
Okay, next time I come, I'm going to be coming early next year for an eye appointment. I'll see if I can do the same, go see him at the same time.
Fantastic.
Okay, thanks a lot, Dr. Lane. Have a Merry Christmas.
All right, Joe, you take care. All right, you're listening to Ask the Doctor. Let's take this next caller, and then we're going to go to the break. Let's see. I think Steve's waiting. Steve in Bradenton, good morning. Welcome to the program.
Good morning. My wife has taken statin drugs for the cholesterol.
Right.
And she's got this cardiologist that she swears by that he's about 80 years old and he's been around forever. And I know your view of statin drugs isn't very good, and I just wonder, how do you challenge that doctor? How do you kind of get off of that? Because I don't want her liver and stuff to go bad,
Well, Steve, I always recommend following your doctor's advice, number one, okay? But there's also nothing wrong with second opinions, okay? If your wife has had a heart attack before, has she ever had a heart attack?
No.
Good. So there is some evidence that after a heart attack, statin drugs may be beneficial. I still don't love those studies. Prior to that, without having a heart attack, I mean, there's not a lot of good studies out there showing that even lowering cholesterol will prevent a heart attack. Now here, we're finding out a lot more than we used to know. I mean, we used to think cholesterol was really a bad thing, but we're finding out more and more and more that cholesterol has some protective nature to it, all right? People that have very low cholesterol from statin drugs are at more risk of Alzheimer's, all right? Also, macular degeneration. Remember, cholesterol is a shuttle system for carotenoids to get to the retina. If we lower them too much, we could be in big trouble. So, what's the magic number? If too low or too high? I always tell this story about my mom. My mom is visiting me right now. My dad's a retired rheumatologist. They're both 89. They're at my Bay home right now. They're doing really well. My mom's cholesterol has been 350 for the last 40 years, okay? And knock on wood, she's never had a heart attack, never had a stroke, never been in the hospital, never had surgery. My dad's cholesterol has always been about 220. He's also in good shape as well. So I think it's always a good idea to talk to your doctor, find out, how low does the cholesterol need to be? Remember, they have to look at other things, not just cholesterol. You got to look at C-reactive protein, homocysteine, triglycerides. We got to look at, all sorts of other types of cholesterol that you have, these fluffy ones, these hard ones, and look at the LDL and HDL ratio. So there's a lot of things that have to be under consideration. So elevated cholesterol is not necessarily a bad thing at all, and I think the new science that is emerging is proving that we may not want to lower cholesterol as much as we used to. And the same thing with blood pressure. After about 80 years of age, we may not be wanting to lower blood pressure as much as we used to as well. Because remember, if we lower blood pressure too much, then the perfusion of blood going to the brain and the eye may not be good. So once again, talk to your doctor. I know with all the cutbacks that this last government did on us from Medicare and all the regulations that doctors have to do with the computer, meaningful use, PQRS, e-prescribe, I mean, all this HIPAA-compliant BS, all right? Yes, BS, is driving doctors crazy, and they have to go faster because they don't have as much time to spend with the patient because they're busy typing. So a lot of times, I hate to say it, patients fall through the cracks, and the doctor fails to spend time with them because they finished typing for 15 minutes, and now they got to go to the next patient. So they say, we don't have time to talk. So you got to find a doctor that still has time to talk to you, regardless of the cutbacks. And there's a lot of doctors out there that are going to sit down and talk with you, and they need to talk to you about diet, exercise, the right foods, the wrong foods, and whether or not your wife can maybe get off some of these statin drugs or cut back. As you know, I'm a big advocate, the least amount of medication that gets the job done. And who knows, maybe your wife may be one that can cut back or get off of her medications. Like I said, nothing wrong with second opinions.
Yeah, she's taken half now of what she was originally prescribed, and it seems as if the number is like a 170. the magic number for these doctors is 200. If it's over that, then you got a problem, according to them,
Right. I mean, I look at other things. I think vitamin D levels, omega index, homocysteine, C-reactive protein, I think these things are much more important. I'm not as concerned, especially from a visual standpoint, an ocular standpoint, if the cholesterol is a little bit elevated, if all these other numbers are good. But oftentimes, when patients' cholesterol is elevated, all the other numbers are skewed as well. So remember, you got to look at everything, the total picture.
All righty. Thank you, Doctor. Merry Christmas to you, and thank you for being there.
Thank you, Steve. Merry Christmas and Happy New Year.
Thank you. You too. Bye-bye.
But I will be back before the New Year, so I'll be able to tell everybody a Happy New Year. All right, I think we're going to go to a break. Stay tuned. We'll be back in about 2.5 minutes for more of Ask the Doctor. So have your questions ready. I know a lot of people are on hold.
Genesis Communications presents the show that's helping people see better and feel better all over Florida. It's Ask the Doctor with board-certified optometric physician, certified nutritional specialist, and popular radio host, Dr. Michael Lange of Lange Eye Care and Associates.
Doctor, my eyes, can I see the sky? Is this the price for having learned how not to cry?
Alrighty. Good morning, and welcome back to Ask the Doctor. I'm your host, Dr. Michael Lange. I'm a board-certified optometric physician as well as a certified nutritional specialist, here to answer your questions regarding your vision, eye care, or a nutritionally related topic. Don't be shy. Pick up the phones and give me a call. Waiting for the first Montgomery, Alabama caller. My mom is Betty Ruth McFadden, actually Betty Ruth Lange now, grew up in Cloverdale on Augusta Avenue. My grandmother was Elizabeth McFadden, was a principal of a school. Catherine McGauley, the Clays, all those are family of mine from Montgomery, Alabama. So you might know some of my family. Anyway, Montgomery, Alabama callers, I want to see if we're coming in loud and clear. 866-503. No. 866-977-4820. 866-977-4820. How important is a routine eye exam? Well, it's very important. A lot of you don't get eye exams because you see well. And you think if you see well, you don't have a problem. That ain't correct, okay? There's an old saying, if it ain't broke, don't fix it, but you can't use that adage with your eyes. You could be going blind right now from an eye disease and you're not aware of it. You could be going blind from an eye disease and you're not aware of it. Glaucoma is the sneak thief of your sight, and you have no symptoms until it's too late. So, once again, it's important to see your local optometrist, optometric physician, or ophthalmologist. Not only are they looking for the first signs of eye diseases, but certainly the first signs of glaucoma, which is the sneak thief of your sight, but the first signs of macular degeneration, retinal tears, retinal holes, cataracts. But maybe even more importantly than that, we can detect plaque in tiny little arterioles that would be a telltale sign that you're getting ready to have a stroke or a heart attack, and you're getting ready to die. From an eye exam, we can detect diabetes, high blood pressure, thyroid diseases, certain types of cancers, certain types of arthritis, lupus, sarcoid, all sorts of things from a routine eye exam. So you can see clearly now an eye exam may not only be vision-saving, it could be life-saving. Get in to see your doctor. Certainly all the doctors at the Lange Eye Institute in the Villages, Florida, we're available for you. We take all insurances, Medicare, but there's a lot of great doctors in your area, I'm sure. All right, we got a lot of people on hold. We're going to go to Melvin first. Melvin, good morning. Thanks for holding.
Hi, Dr. Lange. Merry Christmas.
Thank you.
And I wanted to ask about, I've listened pretty regularly, but I'm calling for a friend that she's in her late 80s that has rather advanced macular degeneration. She's really just found out about it, but the doctors say there's not much they can do for it right now.
Right.
It's dry, and they have recommended a multiple vitamin, a product that she gets from their office, which she started taking. But I've heard you mention some something that you have from Fortify that might be good?
Well, I'm glad you called. This is an area that I'm certainly an expert in. I've done, nutritional evaluations, nutritional blood testing, DNA testing on all my macular degeneration patients for over 10 years. I've probably done more of this than any doctor in the country. And, we found certain deficiencies that these patients have. One was vitamin D. One was B12. One was glutathione. And so there's a vitamin I developed called Fortify Macular Defense, okay?
I'm writing it down.
Right, Fortify Macular Defense. And there's one that I would rather her be on called Fortify Zinc-Free Macular Defense. And I'm going to tell you why. So I've changed this formula 13 times in the last 8 years based on this research I've been involved in. And there's certain things in vitamins that actually can be very bad. And I got to say, the majority of stuff you can buy over the counter for macular degeneration, I don't endorse it at all. They have potential problems. One of them has 80 milligrams of zinc oxide. That's way too much for anybody at any time. 40 milligrams is the most you should ever have. All right, 80 milligrams is too much. It can actually cause neurodegenerative diseases like Alzheimer's. It can cause kidney problems, prostate problems. It can aggravate and accelerate macular degeneration in a high percentage of patients. And this is why I always say, have your DNA tested. Have your ophthalmologist or your optometrist run a DNA test. It's free to the patient. Well, it might be $50. That's the most it could be. You swab out the inside of the cheek. They send it off. We get the results back in 6 weeks. The main reason to do that, I already know they're going to have the genotype for macular degeneration based on the clinical presentation, but I want to find out if zinc is a poison or if their body and their eye is thirsting for more zinc. So that's why I have the Fortify Macular Defense. It has 40 milligrams of zinc in it, and then I have zinc-free macular defense. It's the same one with no zinc at all based on that DNA, okay? If you don't do a DNA study or your eye doctor says hogwash, it doesn't mean anything, or that's because they don't do it and they don't know about it, then go on the zinc-free version, because I'd rather her not be on high dosages of zinc, because there's about 30 to 40% of patients that zinc is actually causing critical problems.
Right.
So zinc-free macular defense, how much does she weigh?
Probably about 160.
Yeah, if she has macular degeneration, I'd probably take 3 a day, and that's what it says on the bottle, 3 a day of the zinc-free macular defense.
Would you take them all at once or
No.
spread them through the day?
Absolutely not. She'd have expensive urine then. So take one with breakfast, lunch, and supper, okay?
Good. Okay.
And then the other thing is, you can go to my website at fortify.com and go to a section on macular degeneration. There's an article I wrote called Nutritional Intervention and Lifestyle Modifications for Macular Degeneration, all right? And it's a 17-step approach. It goes into detail what to eat, what not to eat, and why. If you drink wine, it even tells you the exact brand of wine and why to drink it. And it talks about the DNA. And so it really will help her have a leg up. Remember, until she has 2 feet in the grave, you never give up hope. We can always help them until and then it's out of our hands, obviously, and God's going to help her one day. But for now, if you learn by that article and do what I say, I think she has a strong chance of stabilizing. And who knows? I see people improve on a daily basis. Now, she has to follow her doctor's advice. I'm not stepping on their foot, but a lot, doctors don't know everything about nutrition. This is my specialty. I'm also a certified nutritional specialist. I eat, drink, breathe, and sleep this stuff, and I have a strong passion for helping the macular degeneration patients nutritionally.
Okay, that's what we'll do.
All right. You take care.
Thank you
All right.
so much.
Bye-bye.
Bye-bye.
All right. Let's go back. I think Beth has been waiting patiently. Beth in Clearwater, good morning.
Good morning. Hi, Dr. Lange. Yeah, I'm calling about my daughter that's 20 years old, and she was diagnosed with POTS.
Right.
Yeah, so I just wondered if there was a diet that could help her.
Wow. All right. So POTS, if I remember, it's postural orthostatic tachycardia syndrome. It means when she actually gets a very fast heart rate, tachycardia. Okay, and it usually when she stands up. Is that how it happens?
Yes. Yeah. That's
right.
Usually when it happens. It can happen during the day if she's at school walking around. Sometimes she'll fall down.
Right. The body does not control her blood pressure and her heart rate, and I got to tell you, it can create a lot of fatigue. It can make her, like you said, pass out and fall down. I have one of my employees that has the same similar presentation. She's only 24 years old. She needs to be following for this. I mean, this is I'm big into natural treatments of everything, but this is something she needs to be talking to her cardiologist about. I mean, obviously, and they're already checking this.
She did go to a cardiologist, and her heart turned out, she was
good.
She had an echocardiogram, and it was perfect.
Potassium and magnesium levels have to be checked, okay?
Okay.
Because if those potassium and magnesium levels are low, that could definitely cause that. And it's interesting, I had a conversation with a naturopathic MD from Australia the other day about this, and he said to try to take magnesium salts and put them in hot water and let her soak her feet in that. I'm not endorsing this by any means, but it was my employee, and he said to do that for her, and I don't know if she tried it yet. It's not going to hurt her any. But
no. So what is it? Take magnesium
salts. It's like a cup, and put it in hot water and let her soak her feet in there for 20 minutes. It may do nothing at all, and I'm just conveying what he told me. All right, but this is not my area of expertise by any means. Okay, I just know a little bit about POTS, but not a lot about it. So her primary care physician, the main thing is making sure her heart can handle this. But somebody needs to see her. If you're not getting the advice that you need, then I tell you. Get on the airplane, go to some place like Mayo Clinic in Rochester, Minnesota. All right, go to a world-class facility if you're not getting the answers that you want locally. Okay.
Okay, great.
And Shands up in Gainesville is also fantastic. So
what's that?
Shands at University of Florida in Gainesville.
Okay.
Is also a great place. So, counsel with your primary care physician. If they don't have any answers, get to a university-based, a big center, and see what they can do for her.
Okay, great. Okay, thanks so much.
All right. And Beth, keep me posted. I'm wondering if we're coming in loud and clear in 97.3 FM in the sky in Gainesville and Ocala. Give me a call if we are, 866-977-4820, 866-977-4820. We're also waiting for the first Montgomery, Alabama caller, 866-977-4820. Whoop, look at that. I think we got a Montgomery caller. Hallelujah. Joseph in Montgomery, good morning.
Yes. Good morning, Dr. Lange, and Merry Christmas to you.
Thank you.
You actually answered a question that I had regarding macular degeneration and nutrition and your vitamins. But I've also been recently diagnosed with Sjogren's, and I wondered, within your vitamin line, do you have a particular recommendation that I can order off your website, fortify.com, that would help me with that?
Absolutely. Sjogren's is something I see every day. Patients from all over the country come to the Lange Institute with this. Remember, my dad's a rheumatologist. This is also his area of expertise. Sjogren's is a complicated situation. You get dry eye, you get dry mouth, dry mucosal linings, all right? And it's kind of like a combination of almost arthritis in the eye, all right? So this is called keratoconjunctivitis sicca, big word to mean dry eye, and you know it. Your eyes are burning, sandy, gritty, itch. So first of all, you got to lubricate the eyes frequently. I like Oasis Tears Plus the best. You cannot buy that through any eye doctor's office. You can get it online. I think we have the best price at the fortify.com website. Oasis Tears Plus comes in an individual vial. It's preservative-free. You twist the cap off, put a drop in both eyes. Rub the excess in the paraorbital region around the eye because the hyaluronic acid helps hydrate the skin around the eye. That's a benefit. Gets rid of these wrinkles, makes you look younger. But this binds to the epithelium, basically helping to heal a dry eye, okay? So use that as your lubricating eye drop. Number 2, omega-3 fish oil is crucial. Fortify Super Omega, you take 2 a day of my Fortify Super Omega. If you take Nordic Naturals Pro Omega, you need to take 4 a day. If you take any other good brands that are triglyceride molecule, you got to take 4 a day. But our Fortify Super Omega, you only need to take 2 a day. In dry eye studies, we've seen that 2 a day helps. Also, add the Fortify Focus or 6 milligrams of astaxanthin. The thing is, our Fortify Focus is like $26, and it's got the 6 milligrams of astaxanthin, plus it has lutein and zeaxanthin isomers that have been shown to help benefit the retina, the skin, the heart, and the brain. So it's one little black pill combined with the 2 Fortify Super Omegas. From a nutritional standpoint, that's the double whammy to fight against dry eye. It's not instant. It'll take a couple of months to really kick in, but the Oasis Tears Plus will kick in immediately. Then you got to clean your eyelashes. Remember, the eyes have a lot of grime, grit, bacteria, viruses on it. Clean them with baby shampoo right before you go to bed, or OcuSoft foam right before you go to bed. If you go to our Fortify website, fortify.com, we have some dry eye kits. We have Super Dry Eye Kit. We have Extreme Dry Eye Kit that also gives you our multi-eye vitamin, some other things, and hot compresses. So heat is very important also. Heat up your lids with a hot compress or the Brooder mask, which is included in that dry eye kit on our website. The Brooder mask you put in the microwave for 20 seconds, wrap it around your face, and it heats up the glands, making you secrete a lipid layer, so you're going to have a healthier tear film. And I always preach, there's 4 things you do. You heat them, you clean them, you lubricate, and you nutrify, and that helps your dry eye. If you still have dry eyes, ask your doctor in Montgomery, Alabama, to put little plugs in your drainage ducts. That's called punctal occlusion. That's like synonymous with putting a stopper in the bathtub, or we can do it at the Lange Eye Institute. And lastly, stem cells. The Procura is a stem cell-enhanced amniotic membrane. Severe dry eye cases, we use that. And if we go through all this, even the severest of dry eye patients, we can help them be symptom-free.
Well, thank you. I can order that today. Is that correct on your website?
Right. Go to fortify.com. That's FORTIFEYE, fortify.com, and you can order them individually or look at the Super Dry Eye Kit or the Extreme Dry Eye Kit, and then keep me posted. And thanks for calling me from Montgomery.
I will. And one last thing, one Christmas wish. Why don't you open up an office in Montgomery? We're all dying to see you. You may not know it, but we are.
That's a hop, skip, and a jump for me, but I'll take that under advisement.
All right. Thank you.
Take
Merry
care.
Christmas again, Dr. Lang. It's been
Bye-bye.
a pleasure.
All right. I want to thank everybody for tuning in. We couldn't take all the calls today. I'll be back next week for another hour of Ask the Doctor. I'm out of here. Have a great day, and God bless you.